Hi, I'm Julie McDonald, and this is my presentation on traumatic brain injury. Traumatic brain injury is when the normal functioning of the brain is disrupted, and it's usually caused by a physical injury to the brain, such as a bump or a blow to the head. Some of the things that come along with this at the time are loss of consciousness, loss of memory, inability to move muscles, especially with speech. They can have an altered mental state, such as being confused, unable to orient, and slow thinking, difficulty concentrating. According to the CDC, there are 837,000 cases of traumatic brain injury in children every year in the U.S. A vast majority of these are males. 78.8% of all TBIs occur in males. Children under the age of 14, there are 2,589 deaths and 23,000 hospitalizations every year due to traumatic brain injuries. Traumatic brain injuries cost about $76.5 billion per year, and there are 13.5 million people in the U.S. who are living with the long-term effects of TBIs. Symptoms that follow a traumatic brain injury. There are physical symptoms including headaches, light sensitivity, and sensitivity to sound. There can be nausea or vomiting, feeling tired or sleepy, dizziness, loss of balance or trouble walking, ringing in the ears, double or blurred vision, numbness and tingling, or loss of consciousness. All of these can happen just after a blow to the head and are signs you should watch for that there might be a concussion or a traumatic brain injury. As far as cognitive signs, feeling confused, slow thinking, memory issues, inability to concentrate, lack of judgment, or falling behind in school. There can be changes in sleeping pattern, including trouble falling or staying asleep and sleeping more or less than usual. And emotional signs can include being irritable or fussy, more emotional than normal, feeling sad or nervous, lack of interest or motivation, feeling easily frustrated, angered or tearful, feeling impatient, bolder than usual or acting outside of the person's typical personality, having outbursts, and being unable to cope with the daily routine. As far as causes of traumatic brain injuries in children, I found these to be fairly interesting. Falls are the most common cause. 50.2% are caused by falls. Being struck in the head accounts for almost 25%. It's 24.8% in children, and this includes sports and recreational activities. So that would be about 21%, which was most of the category. So if a child is getting hit in the head by something, it usually involves sports or play. And that's outside of two other categories, which would include motor vehicle accidents, 6.8%, and assault, including physical abuse and shaken baby syndrome, that's 2.9%. So those are other types of being struck in the head that can also cause a traumatic brain injury. And then the other 15.3% are of unknown cause, which from what I could infer, according to what I read, it's just that the injury happened when an adult wasn't present and maybe the child lost consciousness or was unable to express what happened to them or give a reliable account, so they're not exactly sure. But it still typically happens from some kind of an injury to the head, such as a concussion. So now we get to some of the manifestations of traumatic brain injuries in children. And the physical manifestations, they can be short-term or they can last up to the lifetime of the person. Children can have many different symptoms at the same time. They can have some or all. Physically, they can suffer from speech, vision, or hearing impairments, lack of coordination, muscle spasticity, which is where they don't have the flexibility in their muscles. They can have unwanted or unintended movements. They have problems with balance, and often with TBIs, they have headaches that can be chronic and ongoing, fatigue, and sometimes seizures or seizure disorders can come after a traumatic brain injury. Cognitive symptoms from traumatic brain injuries. they can include trouble with memory, both long and short term, trouble concentrating, having a limited attention span, impairment in their communication skills, which could include speech, difficulty reading and writing, difficulty understanding what people are saying to them, and they can also experience poor impulse control, lack of age-appropriate judgment, and difficulty in planning and executive functioning. And these obviously can be symptoms of many of the learning disabilities or intellectual and emotional disabilities and behavioral problems that we've already talked about. So it's very important to know what the causes of these behaviors, if it is a traumatic brain injury, because the prognosis and the treatment are going to be very different. Whereas in behavioral issues, there can be some behavioral modification that takes place that can affect the outcomes. That may not be the case in traumatic brain injury because it is the result of a physical alteration of the brain, and therefore the amount of recovery that happens is not going to be based solely on behavioral interventions. It's going to be a lot more to do with the physical processes that are happening within the person's brain. So emotional problems and manifestations of traumatic brain injury in children. These are very common. As much as it's frustrating for adults to deal with the symptoms of traumatic brain injuries, I'm sure it's as much or more so in children. They can have mood swings, anxiety and depression, lower self-esteem. Again, they may not have the intellectual or emotional maturity to understand fully what has happened to them, but yet they're still experiencing these symptoms that can be quite confusing and upsetting. They may have problems with regulating their emotions. They may have problems becoming motivated. They may appear to be very self-centered because they aren't able to have the forward thinking at the moment to be able to empathize the way they normally would. Kids can also experience sexual dysfunction, acting in ways that are inappropriate or without the normal inhibitions that people would have. And these can all affect how a child is performing both educationally and in their social lives, which again is going to affect their educational performance and just how well adjusted they are in day-to-day life. So what are some of the resources that are available outside of the school setting for people with traumatic brain injuries? The first one that is often used is inpatient rehabilitation. And this usually happens once the patient is medically stabilized. In other words, they're not still experiencing, any swelling on the brain or bleeding on the brain that would necessitate medical interventions or put them at risk for anything. So they would go to a facility that is designed for inpatient rehabilitation for traumatic brain injuries. They would receive several hours of therapy each day, 5 to 7 days a week, and their program would be specifically tailored to their needs. So whatever symptoms that particular person is experiencing, those are the issues that would be addressed in their particular therapy. Inpatient rehabilitation involves a team of professionals that can be doctors, nurses, psychologists, physical and occupational therapists, social workers, and nutritionists. And if there is a long-term stay, I did learn that in some facilities, tutoring can be brought in for the child to help make sure that they're not far behind in school, but it does depend on where they are in their recovery and if they are up to being able to work on those kinds of things. And typically the plan for inpatient rehabilitation is to help with their initial healing, so to kind of gain back some of the functioning that they may have lost from the brain injury, and then to assist in learning how to manage long-term symptoms of a TBI. So they may have to relearn skills that they once already learned, self-care, being able to walk properly and things like that that maybe they were able to do before, and because of the brain injury, they have to kind of relearn those things. So that's what this stage of rehabilitation is for. And then after they complete inpatient rehabilitation, they can either return home or they can be placed in a long-term facility that cares for patients with brain injuries. So if their level of recovery is not going to be such that they can function at home without constant care, then they would need to go to either a nursing facility or a long-term care facility. So after the patient returns from the hospital, whether it's just from the hospital or from an inpatient rehabilitation, there are a lot of therapies that are at their disposal to be able to help with their short and long-term recovery. There's physical therapy. This is to help improve their strength, mobility, their motor skills, their flexibility. It can work on any specific areas that have been impaired physically. Occupational therapy works on improving their coordination, being able to problem solve, and work on mental processing. Speech and language therapy is going to help improve speaking, listening, reading, writing, attention issues, and their general problem-solving skills. And then balance therapy would work on any problems they have with dizziness and balance. And again, some patients may need all of these, some may need only one or two. It varies greatly between each individual with a traumatic brain injury. Another tool that might be used to help people with traumatic brain injuries is medication. There are going to be pain relief and pain management medications. Some may need anti-anxiety medications to deal with short-term and long-term effects. Anticoagulants, as they're healing, may be needed to prevent blood clots. In those who have developed seizure disorders, they might have to be on anticonvulsants. Antidepressants can be used, and antipsychotics. And these are, again, for what we would call behavioral symptoms like combativeness, hostility, sleep disorders, hallucinations, things that are, again, outside of their control and caused directly by the injury, but they manifest as a psychological symptom or a behavioral symptom. They might need muscle relaxants that help if they are having muscle spasms or muscle spasticity. And they might need sedatives in case they have trouble sleeping or problems in their central nervous system. And they might also need stimulants to increase their level of alertness and attention. And I do think it's important to note all of these because they all come with different side effects, different things that might be happening in addition to all the other things that are symptoms of what the medication does. And as teachers, if we're going to be in the classroom with these students while they're on these medications, we may be the first ones to notice if there's a side effect that's troublesome or if something new is happening that might be a cause of a medication. So again, can be very important to stay informed on what medications are being used and what to look out for. So obviously, children with traumatic brain injuries are going to have a lot of challenges, and I talked about some of these before with their different symptoms, the memory, the problems with physical problems like mobility, headaches, fatigue, some of the emotional problems that they're going through. And how is this going to affect them? In school, they may need some assistive technology. Their motor skills may have been affected, so they may need to use a computer or a speech assistance device. They may need extra time to complete tasks. They may need preferential seating. They may need a lot of physical and cognitive breaks so that they don't become overwhelmed and because their attention may have been affected. TBIs can cause physical and behavioral symptoms, and these can vary greatly between each individual person. So it's really important that teachers are going to be in constant communication with the parents and also stay in communication with everyone that's involved in the IEP planning, special education, psychologist, any kind of physical therapy that's going on so that everybody can kind of work together and all the pieces can come together to help the student. And these needs are going to be possibly fluid needs that different things develop, different challenges come up, and some things may resolve over time. So again, it's going to be that constant communication and being flexible and adaptable as the teacher. Children with traumatic brain injuries may present some behavioral challenges which are outside of their control. Again, we're going to see things like outbursts, difficulty controlling emotions, difficulty regulating behavior appropriately for their age. And some of these things can be easily confused with other behavioral issues that students can have. And so it is important to realize that this is not something that they can necessarily control. And even with the modifications that we would generally use for these behaviors, they may not be effective because the cause is different. It's caused by a brain injury, and so the way that it's treated or managed is going to be different. In some cases, the student may need to be considered for an alternative placement, such as a self-contained classroom or an out-of-district placement, depending on the severity of their challenges and behavior. In addition to physical and educational needs, they might have some social and emotional issues that they need to deal with as well, and they may need counseling and support at school as well as outside of school. They may run into things that they're having difficulty dealing with in their social life, just anxieties and depression that comes along with the traumatic brain injury, and it would be very helpful to have resources available for them, and that the teachers may be aware and try to help foster social relationships for the student and help others to be accepting and understanding of what's going on with that student so that they're not left out. There are also a lot of support groups for individuals with traumatic brain injuries as well as their families and caregivers, and I felt like it would be really helpful for teachers to know about these, even if we were just aware of them, so that you could use them as a resource for suggestions on dealing with things. And also, it would be a good thing to be able to offer to families who may or may not have already found those resources. And so I put a link to virtual support groups on my presentation. So that is what I found about learners with traumatic brain injury, and it was quite informative. I feel like I did learn a lot about how this can be very similar to other things, but also very different, and that because of the causes, that the way that you deal with students with traumatic brain injuries may be very different. Things that may work for students with certain behaviors may not work if those behaviors are caused by traumatic brain injuries. Thank you.